call. We're doing a lot here, but let's show you where the real action happens at Children's Hospital. This is brought to you by Turn Services. Adriana Hopkins is there. Adriana?
Hi there. That's right. We are in the PICU, the Pediatric Intensive Care Unit. I'm here with the nurse, Melancon. I had to practice that last name. I got it?
You got it.
Perfect. Okay, so we were just talking a minute ago. Oftentimes, as I mentioned earlier, when you think of Children's Hospital, you think solely of oncology or the emergency room, but we talked already with the doctor from the Behavioral Health Services Unit downstairs, and we're here in the PICU, but there's a lot of things people don't realize that Children's Hospitals treats. It's everything from the straight to the major cancers, and you have a whole list.
I do.
I'll hold it for you.
Perfect. Some of the types of patients that we've seen in the last year, cardiac failure, respiratory failure, kidney failure, kidney transplants, diabetic emergencies. We get all types of traumatic brain injuries, overdoses, sometimes accidental, sometimes suicide attempts. We see gunshot wounds, venomous snake bites, near drownings, and unfortunately we see too many abuse patients in this unit. So there's really nothing that we don't treat in this PICU.
Right. But oftentimes people don't think about, venomous snake bites and near drown. You guys see it all. You are here for it all. You don't turn anybody away. Talk to me about how many patients you see in a year.
In 2014, we saw 938 patients in the PICU, and the average length of stay was 4.2 days. Lots of patients.
Lots of patients. I actually had to pull you away from visiting with a patient. What is it like for you when you see that patient from start to finish?
It's a good feeling, and this can be very high stress. And so it's a good balance, and you really need that when you see these types of patients. But it just makes you feel really good, especially when a patient who came in was critically ill and they come back 2 months later or 3 months later and they smiling and walking and talking, and it just fills you up. It balances the stress out. Yes.
Obviously, when you get a young patient in here, you have a nervous family, probably a nervous mom.
Right.
Well, how do you all calm the patient and the parents and the family down?
Well, we take pride in giving as much attention to the family as we do the patients. We really focus on that because it is very traumatic for the families also. And we have a pastoral staff that we can call in extra, the priest, the chaplain, if we need extra help, child life. We have lots of resources to help with the family also.
What I love about this hospital and what I've learned about today is that you all treat the physical as well as the mental and the emotional and the family. It's a whole unit, a whole body and mind experience. Talk to me about your best memory working with a patient. I know you have so many patients, but if there's one.
I thought about this. There was a cute little girl that I took care of, and she had a brain tumor, and she was my patient after surgery. And I think I probably took like a week's vacation. I came back to work, and I found out, unfortunately, that she had passed on, but I looked in my mailbox, and there was a card. This little girl loved Michael Jackson. That's really all I did for her was talk about Michael Jackson. And a couple of weeks later, there was a card in my mailbox, and attached to the card, her family sent me her Michael Jackson t-shirt, her own personal t-shirt. And I knew it was very special to them, but they gave it to me. And that just still to this day, it just, it gets me right here that they thought enough of me in this place, and I knew I had made a difference then.
It's a tremendous bond that you have with your patients, and their families, obviously. That's got to be something very special and rewarding, as you said, that kind of balances out the stress. Okay, why is Children's Hospital so important to this region?
Well, for 7 years, I did transport, and I went to every hospital in the state. I don't think there was anyone that I ever went to that had the level of acuity that we have in the PICU. And now with our transport service going out and they get more and more patients, nobody takes care of has this level of care at any pediatric hospital in the state that I've been to. And these patients come here now, and we're getting more and more patients, so they must know that we're doing a good job and trust us to provide a higher level of care.
And you did mention that 24-hour transport service. That's helicopter, ambulance, plane. This is the 6th floor unit. It has 18 beds. A lot happening here. As you mentioned, it treats everything. So, last question, most important question. I hope you have your pitch ready. Why donate to Children's Hospital today?
Well, with the level of acuity that we have, it takes, when you have 900 patients, our equipment is vital to us to just provide a basic level of care. With that many patients, equipment, it kind of gets worn out. You can only send it to biomed so many times, and it needs replacement. And with the increase in patients that we're seeing, we have the staff expertise to take care of all of these patients. We need to make sure that the equipment is at that same level too, so that we can help to heal your child. And
then there's also the small things. We see the big equipment in the room behind us, but
right.
I mean, I'm sure you guys go through a lot of Band-Aids, a lot of ibuprofen, a lot of the small stuff, right?
We do. We use lots of stuff in the PICU constantly. It's 24 hours a day, and like I said, for 900 patients, we go through a lot of stuff. We do.
All the more reason to pick up that phone, dial this number, 504-207-KIDS. So easy. It's raining outside, you're inside, you're sitting on the sofa, you're watching us. We can't give you any more reasons. There's no more reasons except that we want to make sure that